Hi guys, welcome back to the channel. For those of you who are new, hi, my name is Matt and I'm a junior doctor working in the UK's National Health Service, and today I want to talk to you about robots. So, the pandemic has changed the world really quite rapidly. We're seeing more telemedicine services than ever before, and we have these fantastic new vaccines that have been produced using revolutionary forms of production. And everything just feels quite different in the health tech space. Now, don't get me wrong, the pandemic has been truly a worldwide disaster, and I don't think anyone can say it hasn't taken a toll on them in one way or another. But if there's one positive thing to come out of all of this, it's the change in opinion to health tech and innovation. So we all know how effective telemedicine has been in various aspects of healthcare, as well as the fantastic success so far of the vaccines that have been rolled out and all the amazing technology behind those. But one aspect I think that's gone a little bit under the radar is how the global pandemic has accelerated robotics within healthcare. And a great example of this is the Moxi robot by Diligent Robotics. The Moxi robot is trying to reduce the workload on staff by taking care of some of the manual labor within the job. In doing so, freeing up staff to focus on the tasks that require a more human touch. But the reason this technology has been accelerated is not actually anything to do with its underlying purpose. It's just the fact that robots are far less likely to spread infection than humans are. This is for two reasons. One, robots can't get sick, so they can't be affected due to being infected. And two, robots are much easier to clean. And if programmed to do so, they're unlikely to forget, unlike humans, unfortunately. You can also clean them with much harsher chemicals than you can humans, and also disinfect them with UV light, which is a highly effective form of decontaminant. The benefits of Moxi really become apparent when you think about its use within a ward setting. Say you have a ward like this, and in half of the bays you have COVID-19 positive patients, and the other half you have patients suffering from other illnesses. Usually, we try to avoid this layout by having wards completely separate, but this isn't always possible. Now you have each of your nurses assigned to one bay, and that's fine. They can each stay within their own bays. The problem being, most wards have a centralized store and drugs room. This means that whenever one of the nurses needs to get something like a catheter or an extra sheet for the bed, they all have to come to the centralized location. This creates a potential hotbed for infection spread between separate areas within these high traffic locations. However, if you have a robot that can deliver critical supplies from these locations to secondary locations nearer to the individual bays, then you eliminate this potential crossover and hopefully save patients not suffering from infectious diseases such as COVID-19 from getting an infection from other patients on the ward who are infected, otherwise known as a nosocomial infection or hospital-acquired infection. Now, the actual robot itself, the team wanted to create a robot that was both effective and durable, while also being personable to the people working on the ward. We'll come to that a bit later. The robot uses a Canova arm, which is a very lightweight robotic arm commonly used to help people with disabilities perform manual tasks. However, they've taken the normal hand-like gripper off this arm and replaced it with the Robotics gripper, which is an industrial-grade 3-fingered gripper, which is able to perform both light fingertip tasks for more gentle manipulation, as well as a full finger wraparound, which allows the gripper to pick up heavier objects with a greater level of stability. Another important feature of this robot is its face. The team, at least for this iteration, didn't want to create a robot that was too humanoid in its features. Personally, I think this was quite a good decision. Humanoid robots, at least at the moment, aren't very well accepted in society. Mainly because people get creeped out by them, and I think that's probably to do with the fact that the robot kind of feels like it's trying to hide its identity from you rather than just being a robot. There's also a maintenance factor to this, right? To create a robot with humanoid features, it requires a lot of really small motors to get those features right. And if just one of those were to break, while not affecting the overall function of the robot, it would certainly affect the way people look at the robot. And that would have an overall impact on its success. By not creating a humanoid robot, they're kind of saving themselves a lot of maintenance cost and a lot of extra effort for really limited to no benefit, to be honest. So instead of creating a robot with humanoid features, the team settled on creating a nice LED design, which I think is really quite endearing. By using some smart gestures and various facial expressions with the LEDs, they've been able to create some very simple and effective expressions without the need to create anything too complex. But for me, the specs and functionality of the robot aren't actually the most interesting thing. I think the integration of a robot into a healthcare setting is really interesting, and it's based on far more than just its functionality. There's a good quote from Andrew Tamaz, the CEO of Diligent Robotics, where she says, and I'm going to read this so I don't get it wrong, "A robot needs to do something functional, be a utility, and provide value, but also be socially acceptable and something that people want to have around." So initially when the team first developed Moxi, they developed it with the view that it would be interacting mostly with doctors and nurses. So they developed various social capabilities with into the eyes and making small bleeps and noises that worked well to interact with doctors and nurses on the ward. But within the first couple of weeks of beta testing, the team realized that the robot was having so many interactions with the general public, far more than they ever expected. But Moxi wasn't really built to handle these interactions at this point. Now, an antisocial robot is probably quite disconcerting to the patients and their families, so the team had to figure out how Moxi was going to be a more social robot. Now, how they did this was really interesting. So rather than just going back to the charger between tasks, Moxi would now do an extra lap of the ward, having various social interactions with patients and their families, stopping for selfies, things like that. They added different hot word detections to Moxi, so if someone wanted to say, "How are you? Good morning, Moxi," the robot would respond not with words, but would respond in a way that made people feel more comfortable having the robot around. Now, that of course presents a problem in itself. A hospital robot that's meant to be restocking the shelves and making sure the hospital is running well is not very effective if it's having to stop every 2 minutes to take selfies with patients and their relatives. Now, the team acknowledges this, and they're currently working on various ways of creating a socially acceptable way of disengaging with the public when the robot needs to get on with its various tasks. One simple way that the team found that they could increase the robot's efficiency was by changing its navigation routes depending on what time of day. For example, if the robot's path takes you past the cafeteria at lunchtime, then the chance for social distractions are very high. But if the robot took a path that was less busy at that time, even if it was longer, the chance of having to stop to take multiple selfies along the way was far lower, and so the path is actually quicker. So if you think about it, you're kind of optimizing your navigation routes depending on how many selfies you might have to take, which is probably the most 21st century phrase I've ever heard. Now, a drawback of the robot is it has very limited speech capabilities, but this was partly by design, because if you create a robot that has too advanced speech recognition, then you might encourage more social interaction, and this would again inhibit its intended function. So rather than actually speaking to you, the robot just beeps at you, which is probably completely acceptable for a robot, to be honest, and you have to draw the line of functionality somewhere, I suppose. But I'm really excited to see where they take Moxi. I think it's really exciting to have a robot actually integrated into the ward, and I can't wait to see where they take it. It'd be great to have it trialed in the NHS at some point. It's currently being trialed at various hospitals in Texas, but to have it in the UK would be really cool. Thanks for watching, guys. If you want to hear more about robots in healthcare, make sure you pop a like on this video. And if you got value from the video, consider subscribing to the channel. And as always, happy deving, guys, and I'll see you in the next video.